We will continue with Part 2 and conclude the lesson of Effective Delegation and Supervision, Chapter 19 of your textbook. Think about it. You don't have to do everything yourself. Even Batman had Robin. For the RN to make safe, effective delegation decisions and develop a sound delegation practice, they must enhance their delegating skills. So we're going to talk about the delegating skills. Establish a foundation of knowledge. No delegation criteria delineated in the state's Nurse Practice Act. No specific skill requirements designated in written policies, procedures, and standards of care. No the delegatee's scope of practice, competencies, and job description. And no professional standards for nursing practice and specific recommendations on delegation. Know the patient. Assess the patient before delegation. What is the potential for change in the patient's condition as a result of the delegated task? Can the patient's safety be maintained with delegated care? Generally, the more stable the patient, the more likely delegation is going to be safe. Know the staff member. Does the staff member have the skills and knowledge necessary to perform the task? Does the staff member perform the task routinely? Be involved in training programs and the development of job descriptions for unlicensed assistive personnel and LPNs or LVNs. Know the task to be delegated. RN delegator must be competent and skilled in performing the task. The task must be in the RN's scope of practice. Routine, standardized tasks are the safest to delegate. Complex tasks or activities that convey high risk for patient complications or unpredictable outcomes must be carefully considered. Explain the task and outcomes. Failure to effectively communicate may result in unsatisfactory performance, errors, or patient harm. Clearly explain the task, what must be done, and the expected outcomes. Demonstration and return demonstration may be required. Expect responsible action. Delegatee becomes responsible for his or her own actions. The RN should supervise appropriately. RN should not intervene unless assistance is requested or an unsafe situation is recognized. Assess and supervise job performance. Make frequent rounds. Observe and communicate. Provide the appropriate level of supervision. Be available for questions or unexpected problems. Supervise in a positive and supportive manner. Intervene immediately if the task is not being performed safely or appropriately. Never ignore poor performance. Document and report. And use mistakes as learning opportunities. And finally, we have evaluate and follow up. Always evaluate the delegated action by reassessing the patient. Evaluate the staff member's performance. Follow up with any interventions that may be required, and review and document the skills that were learned. Another delegating skill is to recognize the characteristics of high-risk delegation. Delegated tasks can be performed only by the RN according to law, organizational policies, or professional standards of nursing practice. Delegated tasks could involve substantial risk or harm to a patient. RN knowingly delegates a task to an individual who does not have the appropriate training. The RN fails to provide adequate supervision. Or the RN does not evaluate the delegated action by reassessing the patient. So when you are going to delegate, remember the 5 rights of delegation. Right task. Delegated task must conform to established guidelines. Right circumstances. Delegated tasks do not require independent nursing judgment. Right person. One who is qualified and competent. Right direction and communication. Clear explanation about the task and outcomes and when the delegatee should report back to the RN. And then we have right supervision and evaluation. Feedback to assess and improve the process. Evaluate the patient outcomes. Supervision and delegation differ. Supervision is the active process of directing, guiding, and influencing the outcome of a worker's performance. On-site supervision is the nurse is physically present or is immediately available while the activity is being performed. Off-site supervision, the nurse has the ability to provide direction through various means of written, verbal, and electronic communication. Now let's discuss the levels of supervision. We have unsupervised. This is where one RN works with another RN in a collegial relationship. Neither RN is in the position of supervising the other. Then we have initial direction or periodic inspection. The RN is supervising a licensed or unlicensed caregiver. They know the individual's training and competencies, and they have developed a working relationship with the individual. Then we have continuous supervision. The RN has determined that the delegatee will need very frequent to continual support and assistance. This continuous supervision is required when the working relationship is new, the task is very complex, and the delegatee is inexperienced or has not demonstrated an acceptable level of competence. Assigning task is not the same as delegating task. In an assignment, power is not actually transferred. So let's look at the definition. Assigning is the distribution of work that each staff member is responsible for during a given work period. There are designated activities that are consistent with job position and description, legal scope of practice, and educational background. The staff member assumes responsibility and is accountable for completing the assignment. So what are the considerations? Well, assigning groups of clients to various care providers, including the unlicensed assisted personnel and LPNs or LVNs, is not appropriate. UAP assignments include functions and tasks. LPNs may be assigned specific clients for which to perform care, but RNs remain responsible for all nursing practice activities. The RN is responsible for assignments made to nursing personnel and should consider the patient's physiological status and complexity of care, infection control or cross-contamination issues, level of supervision required, or, and also the staff development opportunities such as assigning a less experienced nurse to a more complex patient with an increased level of supervision. Interprofessional team members are valuable in meeting patient care needs. RN should know scope of practice and training background of the team members. The RN should know how the work is delegated or assigned to interdisciplinary team members. Interdisciplinary team members may report to the RN who is responsible for assigning and delegating patient care tasks, or interdisciplinary team members may report to supervisors in their individual disciplines and make work in a collaborative manner with the RN to provide the patient care. Now we're going to work on building delegation and supervision skills. First, you need to know novice nurses have barriers to effective delegation. There's a fear of being disliked, losing control, taking risks, making mistakes. There's a lack of confidence or a lack of knowledge. They need to be able to communicate effectively. They need to know exactly what needs to be done and what outcomes are expected. They need to maintain self-control and confidence. They need to listen carefully to the delegatee's response. Ask for feedback by using open-ended, non-threatening statements if the delegation action elicits a negative response. Create an environment of trust and cooperation. Maintain a non-threatening and non-judgmental attitude. Problems will be reported more quickly this way. Avoid blaming and criticizing when mistakes occur. Look for the root cause, such as inadequate training or too heavy of a workload. And encourage staff members to report and discuss problems. You must provide feedback and follow up. The delegation process is not complete until the RN reassesses the patient and adjusts the plan of care as indicated. Provide honest performance feedback to the delegatee. Praise good performance. Address poor job performance. Stop inappropriate, unsafe, or incompetent performance immediately. Document and report to the nurse manager or supervisor. And then, of course, request additional training or other appropriate action to ensure that patient safety is protected. Be careful in what you delegate. You want to make sure you know your responsibilities and the legalities for delegation. And remember, delegating can be very difficult, especially for the novice nurse. Effective delegation is an essential quality for the success of working with others efficiently and being able to provide safe, cost-effective care to the patients. This concludes the lesson on effective delegation and supervision. If you have any questions related to course content, contact the instructor.